It's your health. Menorah Medical Center just opened a new neuroscience and orthopedic center, advancing high-quality care for the region's busiest surgical hospitals. Dr. Kelly Hendricks, orthopedic surgeon, is here to discuss new advances in the field. So you're a subspecialist for complex orthopedic care. What does that mean?
Orthopedic surgery is a subset of surgery. So there's all kinds of different surgeons. As an orthopedic surgeon, I concentrate on the musculoskeletal system. Okay. But specifically for me in my practice, all I do is hip and knee replacements, which is, again, kind of a subset of orthopedics. So that's why I think some people call us a subspecialist.
Tell us about new technologies and breakthrough procedures helping patients.
In orthopedics, there's a lot of different innovation that happens all the time. And specifically, one of the newest things coming around for both hip replacements and knee replacements is the use of robotics in attempting to do joint replacement. It's basically using navigation tools to help us be more precise with how we place the components. And it also allows us to kind of evaluate the individual's joint and put the parts in a way that's specific for that person.
How do you know if you're a candidate for joint replacement?
Well, the most important thing for joint replacement is you've got to have pain. And so it's got to hurt you. So we don't just operate on x-rays, we only operate on people, right? So if you're not feeling any pain, we're probably not going to say you need a surgery. The second thing is you need to have actual deformity at your joint, because when we replace the joint, that fixes arthritis, but it doesn't fix tendon problems or ligament problems or other inflammation in the area. So joint replacement is excellent. In fact, it's amazing at fixing pain from related things to arthritis, but it doesn't fix other stuff.
Are patients getting younger and younger because of sports?
If you look at the data on joint replacement, specifically hip and knee arthroplasty, the average age has come down significantly over the last 20 years. The average age for knee replacement is now below 65. So it's not, your typical patient isn't a Medicare patient anymore because they're under 65. And it is related to a lot of different factors. Some of it's activity levels at younger ages, the ability to take care of ligamentous injuries better from sports injuries when you're younger, and patient demographics. It's just arthritis is becoming more prevalent in our society.
And there's some exciting news. Menorah opened a new neuroscience and orthopedic center. How does that benefit patients?
Well, I think lots of different ways. I think it starts from the beginning and ends all the way through the end. I think the most important thing is it's all we do in that part of the hospital. So we have everything dedicated to taking care of orthopedic or neurosurgery patients, whether it's the way we process instruments in the operating room, or if it's just the way you get into the hospital. I mean, there are no stairs at all in the hospital. So people who come see us often have a hard time getting around, and they're using, walkers or crutches or whatever. And so it's easier to get around just from the beginning. And from my perspective, it's because I work with the same people all the time, and we take care of what we take care of, but we don't do other stuff.
For more stories just like this one, head over to our website, kctv5.com/HCA Midwest.